Hi, I'm Dr. Malpani. I'm an IVF specialist, and today I'm going to talk to you about what the possible reasons for female infertility are, what tests we need to do to find out what the problem is, and what the solutions are. Now, this is a model of the female reproductive tract. Quite a mouthful, and I understand that, but there's really no need to get worried because it's fairly straightforward. And if you watch this video, you'll know exactly what the doctor is talking about when he uses words like fallopian tube and ovulation. So don't get scared. And if I'm going too fast, you can always rewind and replay, and there's lots more information at drmalpani.com. So let's go step by step. We start from the vagina, which is where menstruation or your menstrual blood flow occurs once a month. Regular menstruation usually means that you're ovulating every month. And this is why the doctor will take a history from you, ask you these basic questions. You then have a uterus. The uterus is where the baby grows. So the uterus lining gets shed every month, and that shedding of the uterus lining along with the blood which comes out when the lining gets shed is called the menstrual flow. That's the menstrual period. The day the period starts, the day the flow starts is called day 1. The day it ends doesn't really make any difference. So whether you bleed for 5 days or 2 days doesn't matter. Whether you bleed a lot or you bleed a little doesn't matter. Now, sometimes people get a little confused with that, and you need to remember that the amount of bleeding will depend on the thickness of the endometrium, which doesn't necessarily correlate with your fertility at all. So don't get too upset or worried about this. 99% of the time, as long as you're getting regular menstrual cycles, this most probably means everything is fine. Yes, I understand there are exceptions, but we'll go back to that afterwards. Let's just consider the common stuff first. So that if you're menstruating, that means you're getting regular cycles. And we also then need to think about, along with the uterus, there are what are called fallopian tubes and ovaries. Let's go step by step. The uterus itself is straightforward. It's got a muscular organ, and the reason it needs to be so muscular is because, remember, when the baby is ready to be born, it needs to contract, and that's called labor pains, which are really painful. So it squeezes the baby out until it finally comes out through the vagina. But the job of the uterus is to allow the baby to grow for the 9 months. It's actually quite a remarkable organ. For 9 months, it allows the baby to grow, which means it keeps the mouth of the uterus or the cervix remains shut during that time. It's only when the baby is ready to be born will it actually open, and the baby will then grow up. The uterus lining is actually an extremely remarkable organ. This uterus lining is called the endometrium. The endo is inside and the metrium is Latin for uterus. The lining of the uterus is remarkable because every month it grows and it sheds, and it grows and it sheds. And it does this in a controlled fashion. And that's why women don't bleed to death every month even though they're bleeding. Equally importantly, the endometrium is a really special place because it allows the embryo to grow safely within the endometrium. If you stop to think about it, this is really remarkable because there is no other place in the human body where an embryo can possibly grow efficiently. And that's precisely what the endometrium is designed for. So effectively, the uterus acts in one sense like an oyster, and the embryo acts like a pearl during the early phases of pregnancy so the baby can grow. On either side of the uterus, there's a fallopian tube. Again, the fallopian tube are pretty remarkable. It just looks like a tube, but it's remarkable because it actually has to function in such a way that it allows the egg, which is produced in the ovary once a month, what's called ovulation. It picks up that egg. It actually travels through the fallopian tube, and there are little structures called cilia which beat on a regular basis so that the egg then enters the fallopian tube, and if they have sex at this time, the husband's sperm will get deposited in the vagina. The sperm and the egg will meet in the fallopian tube. Please remember that fertilization occurs in the fallopian tube. And if for any reason this is not happening, for example, if the tubes are blocked, then this is exactly what we do in the IVF laboratory. So the test tube replaces the fallopian tube. Not rocket science, fairly simple enough conceptually to understand that if fertilization is not occurring in the bedroom, in vivo, in the fallopian tube, we do it in vitro in the test tube in the IVF lab. But let's talk about normal fertile couples now. So the embryo is formed after 3 to 5 days. It actually reaches the uterus, it then implants, and then it continues to grow. And if all is fine, you finally have a baby. Which means in order to have a baby, the husband needs to deposit the sperms at the right time. The woman needs to ovulate. The fallopian tubes need to be functional and open. And there is no way any doctor in the world can make out if your tubes are open or not. You can't make out if your tubes are open or not. So your menstrual cycle should be fine because the tube only serves one function, to allow the eggs and sperms to meet and to travel to the uterus. That's all the fallopian tube does. Which means even if the fallopian tube is blocked, it will not affect your sexual life, it will not affect your menstrual cycles. And please remember, for example, women who finished childbearing, who've had, let's say, 3 babies and don't want any more, will actually do a family planning operation where we block the tubes. And this doesn't affect either their sexual life or their menstrual cycle. Once the fallopian tube has helped the embryo to travel from here back into the uterus, that's where it continues to grow. And what are the tests we do in order to check if the fallopian tubes are normal or not? The basic test is called a hysterosalpingogram, which is an X-ray of the uterus and tubes. Sounds simple, but it's painful X-ray because the doctor needs to put a little instrument in the uterus and then inject dye. So that is painful and not much fun. We can also do the test using what is called sonosalpingography, where you use dye. But this is a different kind of dye. It's not radio opaque dye. It is dye which actually contains a lot of bubbles. So it produces what is called an acoustic contrast. You can actually see the dye flowing from the uterus into the fallopian tubes when you're doing a vaginal ultrasound examination. So you can check with a sonosalpingogram. That's not as reliable as a hysterosalpingogram. And the final test is actually doing a laparoscopy to check if the tubes are open or not. We do not recommend laparoscopies. And the reason we don't recommend laparoscopies is because they're surgical procedures. And if you can get the same information you want without subjecting the patient to surgery, why do unnecessary surgery at all? So the tests for the wife are straightforward enough. An ultrasound will allow us to check the uterus. Lots of doctors will do clinical examinations and internal examinations, which is fine, but often doesn't provide very useful information. A vaginal ultrasound is helpful because it allows us to check for things like fibroids, it allows us to check for endometrial polyps, and the vaginal ultrasound will also allow us to check the ovary. Does the ovary look normal? How many antral follicles does it have? What's the ovarian reserve? Does it have a cyst or not? But the ultrasound will not allow us to check the fallopian tubes. And in order to check the fallopian tubes, you need to do the hysterosalpingogram. And the final test for the woman is a blood test to check the ovulatory status. And I'll talk a little bit more about that in the next video. Meanwhile, if you'd like to review exactly what we do in order to check the female reproductive tract, which is the uterus and the fallopian tubes, please review this video again. You want more information, go to our website, which is www.drmalpani.com. We've got hundreds of pages of information, all designed for you. This information is authentic, updated, reliable, no jargon because I've written it, I can vouch for it. And if you then have more questions, go to our website and ask me, and I'll be happy to answer by email, and that's a free service we provide. And if the information we provide you helps you to have a baby, what we call information therapy for infertile couples, nothing will give me more joy, because the reason I became an IVF specialist is to help infertile couples to complete their family. See you.